Hi, I'm Lina Gomez. I'm an assistant professor in the Department of Communication at Drury University, and today I'm going to talk a little bit about my research project that is the use of Twitter for health communication using a social network approach. So the purpose of this research project is to examine particularly how Twitter is used for health communication and information. And we examine a particular network, a particular chat called Salute Use, and it's basically to determine how certain types of user are in this network to see how they impact the information flow. Salutius is a weekly chat that discusses different health topics targeted to Latino communities in the US. And this chat is organized by Salud America, is a Latino-focused multimedia organization in the US. The methodology, we perform a quantitative content analysis and a social network analysis performed to 1,089 users profiles that used, of course, the hashtag SaluteUse. And these tweets were recollected 1 month last year using the analytics software, and it's a free software that recollects and analyzes data. And a total of 4,628 tweets were analyzed during the period. The variables, we establish three variables. The first one is gender, to see if there's an individual, a man, a woman, tweeting, an organization, others. Also the Twitter profile, if the pic was from a man, a woman, group of people, objects, landscape, logo, among others. The third variable is the user role, so we examine the bio of each user to see who they were. If they were health professional, health institutions, traditional media, digital media, government, patients, educators, students, universities, and so many other categories. We're here just showing a few of them. The results, we found that most of the recurrent users were both organizations and individuals, and users that disclosed pictures were mostly organizations with their logos and women. They posted or tweeted more than men. The result, we see that the users that frequently posted regarding Salute Use were mostly health institutions, citizens, and also educators and professionals. And tweets were mainly positive, as we see more of the frequent words were related to health, like Salute Use, like minority health, another organization, health, healthy, retweet. They encourage a lot to retweet. In the social network language, we have out degree and in degree users. So out degree are the most usually the poster, the people who post or send tweets, and in degree are users that mention or tagging. So we see that both organizations were recurring posters and also mentioning users, and some of them were like Minority Health, Salud America, and others. Here we see in a social network analysis, a cluster particularly of Salud America wide a network, and we have here another of minority health. It's a small one, but it's the one of the most posters users in this network. Some network results, we see diameter was 11, density, and diameter means exactly how wide is the network. Density is how close are the participants. If the value is close to 0, means that no one was connected to others. That happens this with this chat. Reciprocity is if users engage in two-way conversation, and we see here is almost 17% of the users engage in two-way conversation. And centralization means that if in the network we found like a dominant users, and mostly if that value is close to 1, it means that we have just few dominants in the network. So in this case, Salute Use was a wide network where only few participants were the ones influencing the information flow, and mostly were related to organizations. So basically, this research helps to identify some key influencers, especially for Salute Use and Salud America, if they want to promote effective health strategies and involving other types of users that are not only organizations and other individuals. Usually individuals in this network were just retweeting or liking the post, but not like engaging more in conversation with them. And so social network analysis is a great tool, especially for see how communities play together and detect some key patterns in the network. So basically, that's my research. Any question, you can send me an email. Thank you.